Now to the coronavirus pandemic surging across our state. Health officials reported another 23,000 new cases. The total cases in the state now 1.4 million, a slight increase from the day before. It continues the trend of rising daily cases, which began in October. Now the death rate is also continuing to rise. The state reported 112 more deaths yesterday. The state's total is now over 20,000. The death rate usually spikes shortly after there is a spike in new cases. We want to make sure you know where your area stands when it comes to ICU bed availability. Right now, the greater Sacramento region is still above the 15% threshold that triggers the new stay-at-home order. This morning, ICU bed availability at 18.8%. That's down slightly from the 20% it was 24 hours ago. Northern California and the Bay Area at about 25% capacity. In the meantime, stay-at-home restrictions are in effect in the San Joaquin Valley and Southern California, both below the 15% number. Those two regions represent 70% of all people who live in California. And happening today, the former home of the Kings will open its doors again to help deal with surging COVID cases in Northern California. ABC 10's Kevin John is at the Sleep Train Arena. Kevin, a lot of folks probably wondering the details on this. When will it open? How it's all going to work?
Yes, Juan, I know there's been a lot of questions surrounding this. So essentially, Sleep Train Arena right here will serve as an overflow hospital because of the fact that a lot of those local hospitals that you mentioned, Walt, have seen a surge in their coronavirus patients. Now, as you can see right here in front of Sleep Train, you'll see the check-in sign, the cones, as they try to get this place ready to take in extra patients starting today. So here's what you need to know. Here at Sleep Train, there are currently 244 beds in the warm status, which means these beds can be activated at any time to serve patients. Now, for context, there are currently 344 overall hospitalized virus patients here in Sacramento County. Now, this arena is one of 11 overflow hospital facilities across the state that are capable of being activated. In total, these sites combine for nearly 1,900 beds. Now, another thing, Sleep Train will be used to treat both COVID and non-COVID patients depending on the need. Now, many of you may remember that Sleep Train was activated earlier in the spring as an overflow hospital. Out of the hundreds of beds ready, the overflow site treated just 6 or fewer people almost any given day from May through early June. Now, I know I said earlier that there are around 244 beds in the warm status here, but Walt, officials here say they could expand Sleep Train's capacity to about 360 total beds. Now, when it comes to staffing here, they say that the staff, as far as the people who will be coming here to help out, will be federal and state healthcare workers. But once again, Walt, this place will be ready to operate as a field hospital today.
Well, I think you brought up a good point, Kevin, that it's not just a COVID overflow hospital. They are there to treat people who need ICU care, whether it be COVID or anything, right?
Absolutely, and that's something important to take into consideration here, because I know that due to the surge in coronavirus cases, people feel that only coronavirus patients will be coming here. But Walt, you have a lot of people in local hospitals, in ICUs that may not be there strictly for COVID reasons or may need surgery for other reasons. So obviously that will push it to capacity. So yes, here they will be taking in COVID and non-COVID patients.
All right, Kevin John with the latest outside Sleep Train, former home of the Kings. Thank you, Kevin. The greater Sacramento region is inching closer to the new stay-at-home order this morning. If and when it does go into effect, how will it be enforced? ABC 10's Zach Fuentes here to answer that question. Zach, good morning.
Walt, the Sacramento County Board of Supervisors plan to vote on an ordinance that would fine people and businesses who violate health orders. That was until public outcry convinced the county's health officer to withdraw that ordinance and rework it. Now the plan is to focus the ordinance on large private gatherings. It comes after videos like this one from Saturday night have been surfacing. It showed partygoers packed together in a tight space with no ventilation in Sacramento. The Sacramento Police Department says they let the state alcohol and beverage control, along with code enforcement, know about the gathering. Chief Daniel Hahn took questions this week from teens who were with the group Impact SAC. He said that is how he would like to see enforcement of health orders go.
To me, is a better way to handle a business doing something wrong handle it through their business procedures instead of putting them in the criminal justice system.
Sac County's public health officer, Dr. Peter Bielenson, says one option for enforcement he's looking at is having it referred to his department by the police and then going to the gathering with police backup if it's needed. Again, right now, Dr. Bielenson is reworking that ordinance to focus on large private gatherings. It's expected to come back to the Board of Supervisors for a vote in the next few weeks.
Zach Fuentes. Thank you, Zach. There is good news on the horizon. Pfizer is expected to get emergency authorization to use its vaccine in the U.S. as soon as tomorrow. The FDA released some analysis showing how effective the shot was in trials. The blue line shows a low rate of people who got COVID after getting the vaccine. Compare that to the red line showing people who did get infected after using just the placebo. Now, the vaccine is not 100% effective. So by the end of the study, just 8 people who got the real vaccine actually did get infected. In the placebo group, it was 162 people. President-elect Biden is vowing to distribute 100 million doses of vaccines in his first 100 days. In the meantime, President Trump is taking a bit of a victory lap. In an interview with CNBC, Pfizer insiders revealed that government officials turned down an offer for millions of extra doses, despite knowing the vaccine was safe and effective.